Today on Investigate TV Plus, vaccines have played a crucial role in preventing life-threatening diseases for decades, but more parents are opting out of routine shots for their kids. I'm Lee Zurich.
And I'm Tisha Powell. We examine the potential impact of those decisions on children's health.
Plus,
I never thought that he would do that to me.
A woman shares her terrifying experience with an abusive ex-boyfriend in hopes of inspiring other women to seek help and never give up on their dreams.
Then, one woman's labor of love for those unable to have children.
I wanted to step in and try to help other women.
Why she chose to become a surrogate, and insight into the resources needed to start this journey.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
In late January 2024, U.S. health officials issued an emergency warning to be on alert for cases of measles following outbreaks in several states, largely among children who did not get vaccinated. Viruses such as measles, smallpox, and polio are virtually non-existent in many countries thanks to vaccination efforts over time. But new data shows one group has seen a drop in vaccines: children, especially those in kindergarten.
A report from the CDC reveals that state-required vaccines among kindergarten students fell to 93% during the 2021-22 school year, a decline for the second straight year. Health experts link this drop in childhood immunizations to a decline in vaccine confidence stemming from misinformation circulated during the COVID-19 pandemic.
The CDC and frontline healthcare providers are now fighting to get young patients back on track, starting with building back trust. Savannah Billiot always knew she wanted a full house.
Growing up, I always wanted 4 kids. I was like, I want 4, I'm gonna stop at 4. I did it.
Got a bonus kid.
More, yeah. And then animals, I love them all.
Holding true to her Native American heritage, she gives her 5 children some of the same natural remedies passed down in her family through generations.
Children. I make the kids medicine. We do olive oil, lemon, and honey. We mix that up, warm it up, and that helps with so much of their stuff.
And her family doesn't shy away from germs.
We always say, we're the family who likes germs,
but rather trust their immune systems to fight back. This mom, who once fully immunized her kids since birth, is now saying no, opting out of childhood vaccines after the COVID-19 pandemic.
I just put a stop to it. And I knew a lot of people that have never vaccinated their kids, or who have and then stopped vaccinating, and so I stopped completely.
And why did you stop?
Because of the push of COVID. It was too new. And the way that it was being pushed and the way all of it was being done, with even testing for COVID, it was being pushed too hard.
Savannah is part of a growing number of parents opting out of getting state-required vaccines for their children. According to the CDC, doses of the MMR, the measles, mumps, and rubella vaccine, DTaP to fight diphtheria, tetanus, and pertussis, the polio virus vaccine, and chickenpox vaccine all decreased among kindergartners for the 2021-2022 school year to 93%, a slight drop from the previous year's 94%. It's a trend that has state and national health leaders concerned.
But when you think about it, that's about 1 in 14 kindergartners who is not up to date on their vaccines. And to me, that's troubling to see this trend.
Dr. Deborah Howry is Chief Medical Officer for the CDC. She says the CDC's Let's Rise initiative is a push to get everyone back on schedule after a drop in vaccinations during the COVID-19 pandemic.
So there's many different ways we get this information out. One is through, talking to the public through media interviews or other outlets. The other is working with pediatricians,
who say there's a lot more hesitancy today when discussing vaccinations with parents than before the pandemic.
Are you having to spend more time with your parents on discussions about vaccines?
Absolutely, absolutely. Definitely since the pandemic and, a lot of the politics surrounding the COVID vaccines and the mandates for this and the mandates for that, and people start to question the system.
Pediatricians Dr. Henry Pelche and Dr. Kenneth Cruz work together caring for children at their clinic in Thibodaux, Louisiana. They're working as a team to dispel myths and misconceptions about childhood immunizations.
What we try and do in our job all the time, because there's a lot of emotion in parenting, is to help objectify things, calm things down, and allow people to make clear decisions.
Because ultimately, the decision to vaccinate or not to vaccinate each child falls on the parents. But the consequences of not vaccinating may have a broader impact on entire communities. According to JAMA Network, herd immunity occurs when a significant portion of a population gains immunity to an infectious disease, indirectly protecting those who are not immune. As Michigan State Medical Executive Dr. Natasha Bagdasarian explains, achieving herd immunity can be tricky.
It varies depending on which disease we're talking about. When we talk about measles, for example, that's something that is highly transmissible. Measles is something that is not only transmitted by people who are near you and in the same room, it can even be transmitted by particles in the air 15 minutes after an individual has left a room. So when you're talking about something that is as transmissible as measles, really, the more people who are vaccinated, the better.
According to the Mayo Clinic, when it comes to measles, 94% of the population must be immune to the virus to interrupt the chain of transmission and achieve herd immunity. The CDC report puts the kindergartner survey just below, at 93%.
So take a look at what's happening around us. We've actually seen an increase in global measles cases over the last several years. And so as our herd immunity goes down in many parts of the country, and as globally there are more cases of these diseases, and people are now resuming global travel, we all are at more risk.
Healthcare leaders we spoke to say the prescription for reducing that risk can only come from increased communication and building back trust.
If we as public health are providing information that is scientifically accurate, but people don't trust our messaging, that's a real problem.
I think we have to respect the dialogue again. And I think that was part of the damage that has been in many fields, not just medicine, but I do think the dialogue has been damaged, and there's so much to learn from dialogue.
As for Savannah, more discussion about vaccines is not likely to change her mind.
I think that'd be very beneficial to other parents making that decision.
Do you think that some vaccines are purposefully put out there to harm you?
I don't. I think for the most part, they're out here trying their best like the rest of us, but it's just not for us.
Savannah says that she and her family still go to the doctor and take medicine as needed, just not vaccines. Dr. Bagdasarian adds that the healthcare system is a victim of its own success because people don't remember how bad diseases such as polio, smallpox, and measles truly were, so there's hesitation to keep fighting against them.
Surrogacy is growing in popularity as it provides a family-building option for people and couples who are biologically unable to have children. Still to come, we examine the process and hear from a mother who decided to carry another woman's child. Plus, a woman terrorized and left for dead by her ex-boyfriend shares her experience.
I laid there for a while. I thought, I'm going to see if there's a God now.
In hopes her story will inspire other abuse survivors to take a step towards healing and recovery. Intimate partner violence, or IPV, is a serious public health problem, and the CDC says it can have a profound impact on health, opportunity, and well-being.
IPV is abuse or aggression that occurs between romantic partners who may or may not be living together, while domestic violence occurs between a parent and child, siblings, or even roommates.
For one woman in Tennessee, she endured weeks of disturbing behavior until she says her ex-boyfriend's threats escalated to violence.
Reporter Kristen Allen shares the woman's story and her powerful message to other abuse survivors.
When you look at Jade Peters, you'll see a successful lawyer, mom of two, and a loving wife. Looking at her now, there's no trace of what she survived in the summer of 2009.
I still would rather consider myself a survivor than a victim, absolutely.
Jade was 25 years old, in college, and recently divorced when she decided to try her hand at dating again.
I sent him a Facebook message and we agreed to go on a date at some point.
She began a relationship and shortly after becoming pregnant, says her relationship turned toxic.
We had had some issues with him constantly threatening people who were on my Facebook and just, saying that he would kill himself or kill other people.
After weeks of what she described as disturbing behavior, Jade broke up with her boyfriend. A couple of weeks passed by when Jade got a text message from her ex asking if he could come by her house to pick up some clothes he'd left there before the breakup. She agreed as long as she didn't have to be there. Jade was at her parents' house down the road. She watched through the window as her ex left her house.
At that point, I think, okay, coast is clear, it's time to go home.
She got in her car and drove the short way home and was caught by surprise. He had been waiting for her to return.
It was apparent that he had parked his vehicle up the road and walked back there to confront me. I was trying to use my key for my vehicle to set off the alarm so that it might alert my parents or someone else.
But her key fob stopped working and the alarm never went off.
Then he said, "I'll kill you," and he fired a weapon twice, striking me in the face.
She was instantly knocked unconscious. Jade remembers hearing him run away, but she doesn't remember how long she waited for help.
I laid there for a while. I suppose, I'm going to see if there's a God now.
She was flown by helicopter to UT Medical Center, where she had surgery to fix a torn esophagus and rebuild the roof of her mouth. Jade still has bullet fragments in her spine and skull. Her unborn child survived.
I never thought that he would do that to me. I wasn't afraid of him. When he pointed the gun at me, I was just like, what are you doing?
Still, this is not the end of her story. Jade was determined to finish her education. She eventually received an associate's and bachelor's degree before earning a full ride to law school and graduating.
If you have a dream and you let someone take that from you, then in a way you're still being victimized. I think it's just so important to not let your dreams wash away because of something that happened to you, but to take control and be the person who makes your life happen and shape it the way you want.
Well, Jade is sharing her story of survival to give others hope. She has since opened her own law firm and married a law enforcement officer. As for her shooter, he pleaded guilty to second-degree attempted murder and served 10 years in Tennessee State Prison. He has since been released. In Knoxville, Tennessee, I'm Kristen Allen.
Still to come, a math prodigy sums up his love of numbers.
3,000 minus 100, that's easy. 2,900.
We introduce you to a fast-thinking first grader who solves complex equations without breaking a sweat.
But first, surrogacy is becoming a popular option for people who are unable to have a baby. We go in depth with a surrogate and hear why she chose to carry another woman's child. In surveys of childless adults, the National Institutes of Health found infertility routinely ranks high among reasons for not having kids. For some infertile couples, singles, and same-sex couples, doctors say surrogacy could be a solution for either starting or expanding a family.
Yeah, a recent study by the IMARC Group found the surrogacy industry has increased in popularity due to advancements in medical technology and changes in social attitudes toward non-traditional families.
There are two types of surrogacy available. Altruistic surrogacy, where a surrogate is not compensated beyond medical expenses. Most of the time, the surrogate is a close friend or relative. Commercial surrogacy refers to an arrangement in which the intended parents pay all the cost, including a fee to the surrogate.
Reporter Brittany Ford spoke to a woman who was paid to carry another woman's baby following the births of her own children.
Let's go play, Papa. 26-year-old Yesenia Latoure's pride and joy is being a mom.
Oh, you're so sweet, Papa.
After I had my son, he was around 1 year old, and I found myself unexpectedly pregnant again.
That's when she received devastating news.
I eventually had a miscarriage in 2018, and it was one of the hardest things I ever went through in my life.
Experiencing a miracle shortly after with the healthy birth of her second child. She became inspired.
Going through my miscarriage made me think about all the women that are not able to have children.
Taking on the role of a surrogate. Her story gained over 200,000 followers on TikTok, flooded with questions and interests. And experts say it's no surprise.
It's booming and surrogacy is exploding.
Dr. Daniel Shapiro is medical director at Reproductive Biology Association. He says societal changes are fueling high interest in reproductive alternatives.
The big things are the LGBTQ community using surrogacy for obvious reasons, women with health problems that make it unwise for them to try a pregnancy, or women who have tried and their uteruses have gone through whatever and rendered them incapable of safely carrying.
The commercial surrogacy industry is expected to be in the billions in the next 10 years.
It'd be hard to spend less than $150,000. And the most expensive part of that is the surrogacy, not the IVF.
Putting women like LaTorre willing to carry in high demand.
I wanted to step in and try to help other women.
LaTorre isn't planning another surrogacy, but has found newfound purpose through her advocacy work.
I know I have touched so many women's hearts.
Well, a typical surrogacy journey is not cheap. The National Institutes of Health estimate the cost of surrogacy can run between $100,000 to $200,000. Medical expenses alone can cost as much as $80,000, and intended parents will pay a fee of at least $20,000 to the surrogate herself. In Atlanta, I'm Brittany Ford.
Compensated surrogacy is banned in Nebraska and Louisiana, and both commercial and altruistic surrogacy are not allowed in Michigan. In other states, the laws for surrogacy vary.
Up next,
8 squared minus 14 times 3 minus 6, and take the square root of that.
we'll put this mini mathematician to the test and check your number knowledge too.
Do you have time to grab a pencil and paper? Okay, that might be asking a lot, but we have a pop quiz for you. The score of Emma was half as that of Ava, and the score of Mia was twice that of Ava. If the score of Mia was 60, what is the score of Emma? You got this, right? You got your pen and paper,
I'm
Tisha?
working on it.
Yeah, 12A, B15, C20, or D30. You know the answer?
No.
I don't either. I'm trying to compute it in my head.
Yeah.
No idea at all. But we're going to give you the correct answer in just a moment. But what inspired us to go back to school is a number crunching, digit deciphering first grader in St. Louis.
Nathan Catcher is just 6 years old, but he's already solving math problems at a 7th grade level. Reporter Caroline Hecker introduces us to Nathan, the number kid.
First grade is a year of learning the fundamentals.
What do you think they're thinking about?
Reading, science, history, and math.
Cover this whole guy web.
Math is something Nathan Catcher knows a little something about.
3,000 minus 100, that's easy. 2,900.
Okay, a lot about.
Easy peasy.
While he's like every other 6-year-old in his class, he is in a league of his own when it comes to math.
Because I like learning new things. And I'm solving equations.
Nathan spends his days at Green Trails Elementary.
I look funny.
Practicing his reading and learning alongside his classmates.
Turn the page.
But when it comes to math, he's working at a 7th grade level.
Is one of those bigger than the other?
Getting one-on-one lessons at school and outside of it.
This was 12 times 3, right?
His mom says she knew math was his thing as young as preschool when he was counting instead of napping.
He would count in his head and he would remember that number, and then he would come home and tell me Today I counted to 1,255, and then he would divide that by 60 in his head and tell me exactly how many minutes that was.
5 plus 2.
Down the hall in 3rd grade, Nathan's brother Evan is his biggest supporter.
I think he's a genius.
He says the math gene runs in the family, sort of.
Well, it does for Dad, Mom, and Nathan, just not me.
So we had to put Nathan to the test, on the fly, and right before lunch.
8 squared minus 14 times 3 minus 6, and take the square root of that.
12.
Genius. Got it. You can check out Nathan on his TikTok channel, Nathan the Number Kid. And earlier, Lee asked, the score of Emma was half as that of Ava, and the score of Mia was twice that of Ava. If the score of Mia was 60, what is the score of Emma? Well, if the score of Mia was 60, therefore, the score of Ava is 30. Since the score of Emma was half as that of Ava, therefore the score of Emma is 15, so the answer is B, 15. In St. Louis, I'm Caroline Hecker.
You had B all the time, right? You knew it.
I thought it was something else. I won't tell you which one I thought it was because I want to be considered smarter than a first grader.
Yeah, I know what I was going to say, right? Gosh, you hear that kid in the math. When they were doing that computation during the story, I'm like, I have no idea. No idea.
Oh, gosh.
I know. Smart kid. Yes. All right, that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching. Next time on Investigate TV Plus, they fought to keep our country safe, but tens of thousands of veterans now live on the streets.
How many times in your life have you been homeless?
3 now. That involuntarily 3.
An in-depth look at veteran homelessness and a potential solution popping up around the country.